Hi, I'm Mike Mew. These is our series of questions in September 2025. I have a question. What is the correct form of mewing? When I make a suck or swallow motion inside my mouth with the teeth and lip gently closed, the tongue rises and gently touches the palate like my head resting snugly on a pillow. I feel a tightening in the muscles under my chin and around the neck airway. Is that correct? Here we go. What is improper form? I will never forget listening to a colleague of mine pontificate about where the end position, whether the tongue should be touching the back of the teeth or the gums or where it back, and he was pontificating and I let him just go on, because really you've got no modern humans who are anywhere close natural form. I would imagine that what you've got is you've fallen into a swallowing pattern that is probably deep bite, okay, from the description you're saying here. And so when you are trying to gain a suction hold, your tongue wants to stretch out sideways and you're pulling that together, and that is probably tensing up the styloglossus muscle, or maybe even the stylohyoid ligament. So, I mean, I notice the muscles running up, there's, when you look at the literature, you'll see there's a relationship between in the postural innervation. Remember that you've got different postural innervation centers, because clearly, you run one moment, you stand another moment. These are two very different functions you do. The muscles are innervated from different centers. And so the same postural center, God, that's a long way of saying something simple, is affecting the deep cervical muscles and the back third of the tongue. So we know these muscles are all involved in posture of the head. For most people, with your tongues hanging open, it's not involved in the posture of your head. And funny old thing, people's heads fall forward. So that's another reason people are getting forward head posture, apart from all of the other aforementioned things like blocking people's noses. They have to hold their head forward because they lack tongue space. Hey, you ask, is it true that having one but not the other would constitute improper form? You've got improper form, and you've probably had improper function your entire life, because we nearly all do. So it's really difficult to start to unpack everything going on here without clearly physically seeing you. And even if I did physically see you, remember, I can't actually look inside your mouth while you're functioning or posturing. Do teeth extraction prevent me from reaching my full genetic potential even if no retraction was done? You're saying no retraction was done, so what, you didn't have any form of treatment? Now, let's say, for argument's sake, you just had teeth taken out but no treatment at all. Two different things. You could have had your wisdom teeth out and no treatment. Great. Well, first of all, very few people are going to reach their full genetic potential. I think I've had one patient who I think came close, and he was brought up in the Amazon rainforest in a relatively remote tribe, and he then went and had a westernized education around 8 to 10 years old. He was clearly an exceptionally bright kid, because he ended up working in the city in London. So you imagine this, you were born in a remote tribe, and you end up working in the banking industry in London city centre. So you would argue, some people would argue your life hasn't gone well, but clearly I think he had done very well, exceptionally well. And of course he had actually gaps between his teeth, which I think is because anyway, listen, but that wasn't the answer. I don't think you're going to reach your full genetic potential. And of course it totally, the question is why you had extractions. And if your extractions were just for decay, then maybe you've got your full genetic potential. I can't tell you if you haven't. But if your extractions were done because there was a lack of space for the teeth, then you're already in a bit of a hole. Now, it's very hard to get out of a hole. It is. I mean, when you look at all the self-help books, when you look at all, that's what we're all doing. Our objective is I'm coming out of a monetary hole. I'm coming out of an educational hole. I'm coming out of a psychological hole. We're defined by our problems. Everything we're doing in life is to come out of a hole. And everyone's on that slippery slope, aren't they? And if you're too far down and you don't make enough effort, no, you're not going to get out the hole. If you're not so far down and you make a lot of effort, then you can get out the hole. And then incrementally on that lip edge, that's where we are. Then this is all your problems, all the way through your life, in every facet, in every angle. And it's not so much about the situation and the state you're in. It's often about how much effort you are going to make to get out of that hole. So, same person. I recognize this. K. Barum. Doctor, please answer. We might get more information here. I had 4 teeth extracted at the age of 10 and mewed since 12. I did not get any retraction done because my ortho simply spread my crowded teeth into my extraction gaps. I had crowded in both arches. Extraction did not change my profile, but I wonder if it prevented me from reaching my genetic potential. Could you please make a video about teeth extraction? I guess I have made some videos on teeth extraction, but okay. So what you're saying here is your ortho didn't do retraction. He simply moved the teeth around. Well, yeah, often that's not retractive, but the problem is when you start moving teeth around, the easiest movement that they make is extrusive. That means is to move out of the bone, which increases facial height. That's just physics. That's just how it works. And if you put fixed braces on, probably less so than if you put aligners on, but particularly fixed braces. If you pull one tooth down and you pull another tooth up, the one you're pulling down comes down more than the one that goes up. So the net effect is usually down. And also, as you move teeth around, they tend to interfere with each other, because right now I can bite together. I've got a nice solid bang, because they all meet together, crunch. And that's because you've got these little micro mechanisms that align teeth up so they come together. Whereas if you're straightening teeth out, by definition, you've got to move teeth around to get them into position. And in that transition phase, the teeth don't bite together well. Because they don't bite together well, you aren't biting together as much, and because you aren't biting together as much, you're going to reduce your masticatory effect. Whatever that is, I don't have to define it. It's the masticatory effect. When you're saying any retraction, you're meaning actual physically pulling back. That's by retraction. Okay, fine. You've not had retraction. Good. Retractive techniques really are types of headgear, I would guess, or mini implants pulling back, or maybe pendulum devices, whatever they are. I know, but I'm not going to explain right now. And you said extraction didn't change your profile. Great, I'm really glad to hear that, because again, the biggest factor in all of this is you as an individual. You had these teeth taken out at the age of 10 to make space. If you're mewing since the age of 12, I'm guessing you're mewing through the orthodontic phase, I would imagine, just from knowing when teeth come out. So I would imagine that would help your posture, or your facial profile, with good posture, not to deteriorate. Great, well done, fantastic. Can you improve and get better? Yeah, of course you can. Yeah, it's no great problem to improve and get better. You just carry on getting better. Just don't stop. Just get better and better and better. It's no problem. The problem is you being in a hole. As I was describing, answering your previous question, it's where you are on that slope. It's literally time and effort. This is not rocket science. It's pretty bloody simple. Yes, I can give you tips and hints. That's, you go down the gym. You want a personal trainer in the gym. What are they going to do? One, they're going to motivate you. And that's the biggest factor of having a personal trainer. And second, they're going to give you tips and hints to help you improve. That's what I'm doing here, giving you tips and hints to improve. But the biggest factor is your hard work. This month I will turn 20. Am I too late to start mewing and see results? Well, here we're in a great debate, aren't we? You're never too young to start mewing. Start mewing. Mewing's how you should be. It's like saying, shall I stand upright and shut my mouth? What do you reckon? Do you think you should be like this? Or should you be like this? Mewing's just a good biohack, using suction to hold this. For crumb's sake, should I be mewing? Should I start mewing at 20? Start mewing. There's no question. Just Mew. You can get my app, or you can just hold a suction. But it's crazy not to, Now, am I too late to start mewing and see results? Well, clearly you're not too late to start mewing. Will you see results? Well, it takes time. I remember when I was doing a clinic and people come in to me saying, can I get changes, what would do? And I would chat to them and I'm saying, I can help you to get going with a little bit of expansion, but you're going to be doing most of this stuff yourself. And they would say, oh, doc, well, yeah, but how long till I see results? And I go, well, it's going to take you 2-3 years to see anything. But then it's like compound interest, because the more change you get, the easier it is to get change. So I always say you go along like this and then slowly you cruise up. I don't think you go up like that, but I think you gently make an increase in changes. Now, I would have people turn around to me and go, oh, God, years, well, I want results now. And I go, what now? You're in the wrong place. You should go down the surgical department down the road, because they get results straight away. Shocking how much relapses afterwards. Shocking. But they do get results straight away. Next person comes in as a bodybuilder. And when I say the same thing, and the guy would go, yeah, well, it took me 10 years, a decade to get a body like what he's got. So he wants to, and he understands, it makes total sense to him that it takes that time to get change and see results. So, you're 20 years old, great, you can get so much change at 20 years old. Now, I normally say that if you start chewing, you can get change in this area, okay? And I sort of see changes in this area, I think, at almost any age. I mean, any reasonable age. Start going over 40s, into 50s. Well, at that point, people are starting to head south. So are you getting results, or are you just slowing down, going south? What I notice when I look around at my contemporaries, I've got a better jawline than them. A lot of the guys that I remember when I was young, and I would have, because, come on, as a young person, you look around and you make an assessment of where you stand amongst your peers from a facial appearance perspective. I know mewing's a lot about facial attractiveness. I'm trying to stay on the health side. I know a lot of you guys are here because you want to look better. Fine, we've got an agreement. I want you to be healthier, you want to look better, but we've got, different reasons for the same thing, okay? I'm more interested in your health, but I am very aware that when I was a young man, I was aware of who were in my league, so to speak, or who was out of my league. I think, come on, most guys admit that. Now, I look around at the guys who I felt were in my league today. I mean, recently, I'm afraid I've been to a lot too many funerals recently. We seem to be going through that phase of funerals of my friends' parents. So the last 2 to 3 years, I've been to 4 or 5 funerals, including clearly my own father's last week, 10 days ago. And might I say that there was more young people. It was a massive event, my father's funeral, way bigger than any of the other funerals I've been to. But the amount of my friends was a testament to my father's engagement. Sorry, I'm going off on one. When I looked around at my contemporaries, I've done very well. Now, have I got better in the last 10, 15 years? No, I don't think I have. So, what I've done is I've stopped myself getting any worse. Now, that's a really important point. Don't forget that point. It's easy, there's 2 different things here. So I would imagine up till about 40, 45, you're asking me, can I improve? Yes, I think you can, okay? After that, what you're doing is you're limiting deterioration. Now, that said, don't forget, I've seen people at 80 years old who have had a stroke, and watching the change, which is repeatable, it's relatively rapid, and it's relatively noticeable. It's quite obvious. So, and that's quite a powerful statement, isn't it? So if you at 80 years old can get repeatable, rapid, and noticeable changes from switching a muscle off, then in theory you should be able to get the opposite. And remember, that's just the facial musculature. I've said this before, I've seen people who have had road traffic accidents where they've damaged the trigeminal nerve. That's the one that drives the power muscle. You don't really get strokes in the trigeminal nerve, or I think if you do get a stroke, you die from that type of thing. That's such a deeper level problem going on. So I say, and then let's wind back. So in my thought, I talked about the outer edge here. I think that when we're talking the maxilla, this area here, I think the average person is going to struggle over the age of 20. That's just my rule of thumb. I don't know that. That's just from what I've seen. So, Yash, this is new, for crumb's sake. This is simple. Did you mew anyway? There's no reason not to. I mean, it's like, should I stand up straight and shut your mouth? Yeah, go on, you should, mate. All right, so those are the questions. I wanted to make a summary reminder that we're going to be looking for the best mewing outcomes. I want to hunt the world to find the people who gain the best outcomes, to learn from the people who've done it, so that we can spread the information and help everyone. My real goal is to get prevention and then move on to help you with the minimum amount of operative work to get the best results. So try and work out how we can nudge you, or you mewers, with a little bit of artificial assistance to help you get the best outcomes. And by understanding the best mewing outcomes is really going to go a long way to help learn what we can do to build this whole thing and get better results, okay? To help you fulfill your full genetic potential.